Greetings, aspiring nurses. This is Nurse Ed Scholar here. Today, we're going to embark on the journey into the neurological assessment. So, let's dive into the subjective and objective data that we're going to need to unlock the complexities of the human nervous system. So, when we begin, you know, we need to start deciphering the patient's story. So we're going to ask them about vertigo, headaches, dizziness, tremors, any weakness in coordination, any numbness or tingling in any part of the body, difficulty speaking or swallowing. Okay, because as diligent nurses, we're going to need to also, probe into their history. Do they have any history of seizures? What medications are they taking? Any recent head injury, any, surgeries, um, any potential environmental hazards or occupational hazards like exposure to chemicals, drugs, alcohol, because this subjective data is really going to guide us uh, through the neurological system. Okay. So then when we move on to objective data, now we're digging deeper, you know, um, kind of gathering information from assessing those cranial nerves, to looking at vital signs. We're going to have to determine the patient's level of consciousness, their pupil reactions, what's their motor function, their coordination, the sensory function, the cerebellar function, and all of the reflexes, all that's going to come under scrutiny, in our objective data collection. We are going to assess a patient's mental and emotional status, looking at, what's their behavior, what's their appearance, their language ability, any kind of intellectual functioning. Um, we're going to, especially when we're looking at level of consciousness, we're going to need to check for alertness, confusion, delirium, unconsciousness, stupor, and coma. Your assessment will become increasingly invasive, especially as the client is less responsive. You're going to do more things when the patient is less responsive. They're not going to be able to react normally. So your gathering of objective data is going to be more invasive. You're going to even use that Glasgow coma scale to note the patient's eye movement, their motor response, and their verbal response. So as we move on, we're going to assess the reflexes and the sensory function of a patient. We're going to assess deep tendon reflexes, plantar reflexes, looking for any meningeal irritation signs, revealing any kind of abnormalities of the nervous system. We're going to assess for sensory function, testing for any pain. Can they feel light touch? The position sense, which is the ability to kind of perceive passive movement. Um, Stereogenosis, which is the ability to recognize objects placed in a patient's hands. Okay. Because with the neurological examination, there's going to be, well, there should be plenty of responses and reactions based on our assessment. Okay. And when we go into teaching, because as nurses, we teach a lot. When we go into teaching our clients, we're going to empower our clients with knowledge that they're going to need. We're going to need to educate them on removing environmental hazards, or avoiding them, like, insecticides, exposure to lead. We're going to educate them on avoiding high risk behaviors that may lead to head or spinal cord injuries. We're going to emphasize on the use of using like protective gear, seat belts, um, and anything that we need to instill the importance of safeguarding the patient. Okay. And these things that we're going to have to be knowledgeable of, in preparation of teaching our patients. Okay. So that was a quick overview of all of the little nuggets that you're going to need for the neurological assessment. So congratulations. Um, just keep at it, keep studying, you know, uh, some things you're going to have to memorize, some things you're going to have to comprehend. But when it comes to nursing, you have to learn all of these things as a foundation so you'll know how to apply it, because it's all about application on up in the Bloom's taxonomy. But application of these um, assessments on our patients to understand um, their physical health and mental health. So may your journey be enriched. And until next time, please keep exploring, learning, and thriving. And also, please like and subscribe if you are gathering any knowledge from these videos.